Hello everyone. So let me begin the today's presentation with a beautiful quote. Life isn't about finding yourself. Life is about creating yourself. Myself, Dr. Kanika Gupta, Professor, Department of Pediatric and Preventive Dentistry, Teerthankar Mahaveer Dental College and Research Center. I extend my warm greetings on this beautiful platform of ICDO. Today I'm going to discuss about the most important topic, that is decoding the pediatric oral lesions. The topic will be
हेलो
covered.
बोल
Hello. Yes. Is everything is visible?
मैं वही बोल रही हूँ ये तो पूरे डाल
You can
एक
continue.
मिनट
It's clear. Please
Yeah,
proceed.
okay. Thank you so much.
हाँ
So
बोल
the topic will be
हमेशा तेरे साथ
discussed.
ही ऐसे होते हैं
I think someone mic is open. Can you just mute your audios? Thank you. So the topic will be covered under various ages and stages of pediatric patients. Then different oral lesions that we encountered in neonates. What are the various clinical and pathological clues to identify such lesions, and how we manage these lesions, and what are the parental reassurances that we can provide, and what is the role of the teamwork in managing such kind of lesions. So let us discuss and start with the ages and stages of pediatric patients. So pediatric patients are basically classified under the various age groups, as you all know. From birth to 2 years, we have the infancy or the neonates. Then from 3 to 8 years, it is the early childhood period. From 9 to 11 years, it is the middle childhood. And from 12 to 18 years, it is the late childhood and adolescent period. So today we are going to discuss about the neonates and the oral pathological lesions that are being encountered in the neonates. So what is the neonatal period? So neonatal period is that period in which the child belongs to 28 days of his life or 4 weeks of his life, and it is the most crucial period of the child health. So, according to the WHO, it has been noticed that 41.6% of the total mortality rate under 5 years mortality is contributed because of the oral lesions in the neonates. So, why it is highly important to understand these lesions in the neonatal period? According to the American Academy of Pediatric Dentistry, the perinatal and infant oral health are the foundations upon which our preventive education and dental care is basically built. So, to enhance the opportunity for a child for a lifetime free from the preventable oral diseases, it is highly important to understand these lesions. So, recognizing that the dentists, physicians, various allied health professionals, community organizations, they should be involved as the partners to achieve this goal through anticipatory guidance, the preventive strategies, and the therapeutic interventions. So, how we can manage it through the anticipatory guidance? Anticipatory guidance involves the complete assessment of the growth and development of the child, awareness to the parents regarding these lesions. In case of any lump or bump in the oral cavity, it should be identified at the earliest. Any incidence of the tooth-like substance before 1 month of the child age, it should be identified. We should encourage the maternal and the child oral hygiene. There is highly important role of nurses, the pediatrician, and the healthcare professionals that are specially dealing with the child healthcare. So it is highly important to for a dental team to become aware and make the efforts to identify such kind of the lesions. So let us start with the various oral lesions in the neonates and what are the clinical and the pathological clues about them. So the most commonly encountered are the cyst, the tumors, then we have the traumatic oral lesions, then different kind of the bacterial, fungal, viral infections in the oral cavity of neonates, and the other are the autoimmune diseases. So why it is highly important to diagnose and manage these lesions? Because most of them are misdiagnosed. They are left untreated because of lack of resources and because of lack of parental education. Because of the limited resources, limited reporting, and the misconception, these lesions can lead to the various systematic diseases. So it is highly important to make the child healthcare professionals as well as the parents aware, knowledgeable, and reporting these lesions to the pediatric dentist or the pediatricians. So coming on to the first kind of the oral lesions in the neonates, these are the cysts. The gingival and the dental lamina cysts are commonly occurring on the crest of the maxillary and the mandibular dentinal ridges with the prevalence rate of 13.8%. They commonly happen because of the remnants of the dental lamina that are commonly known as the cell rest of series. The second most common cyst in occurrence is the mid-palatal raphe cyst. These cysts are non-odontogenic in origin. They commonly happen on the mid-palatine raphe with the prevalence rate of 35.2%, and they happen because of the entrapped epithelial remnants. Bone nodule that you must have commonly been heard. These are with the prevalence of 47.4%. These are the keratin-filled cyst and the derivatives of the salivary gland structures. These are the kind of the numerous nodules commonly seen on the hard and the soft palate junction and even on the buccal and the lingual surfaces of the alveolar ridges. Then we encountered the bluish dome-shaped translucent kind of swellings. These are the eruption cysts that leads to the control or impediment of the eruption of the deciduous or even the permanent tooth. So in neonates, obviously the deciduous teeth. And these eruption cysts are identified using the fine needle aspiration biopsy. And the treatment involved the surgical extraction or the marsupialization. Epidermoid and dermoid cysts, these are benign developmental disorders that are commonly seen on the submental region and floor of mouth. But these cysts can lead to the respiratory distress and feeding difficulties. Histopathologically, they are identified being lined by the epidermis, whereas the dermoid cyst has the presence of adnexal they have the presence of adnexal gland, and the treatment involved is the surgical enucleation. The next oral lesions commonly seen are the infections. Osteomyelitis, seen in 1 to 7 neonates out of 1,000 hospital admissions. The male predilection is commonly seen. The preterm newborns are commonly infected with osteomyelitis. This happened because of prolonged hospitalization, impaired nutritional status, ventilatory, sport, and nosocomial infections, especially because of S. aureus or E. coli. Maxilla is most commonly involved, and the clinical features that you observe is the fever, edema, redness on cheek, conjunctivitis, nasal discharge. Blood cultures, ESR, and leukocyte count are helpful in identification, and the treatment involves the surgical intervention and antimicrobial drugs. Herpes simplex virus infection that is commonly happen in 1 in 3,000 or 20,000 live births, occurring because of herpes simplex 1 virus. And it may happen because of the maternal infection, so it is a vertical transmission. The eruptions happen in the form of the vesicles. These are either single or in cluster, 1 to 3 mm in size. They ulcerate in few days. Identification involve the serological test, PCR, and viral cultures. Treatment is you can go for the antiviral drugs like acyclovir. Candidiasis, as you must have commonly heard, it is the second most common cause of the mortality in neonates. It happened in 2 to 20% of preterm newborns. Candidiasis commonly occur because either from the external contaminations or the vertical contamination from the mother. It happened because the neonate have the immature immune system or because of prolonged catheterization and the prolonged hospital stay. Occurring because 75% cases occur because of Candida albicans infection. They appear in the form of the white plaques. The fungal culture in blood, urine, CSF can be helpful in identification, and the treatment involves the complete maintenance of the good oral hygiene that can subside the candidial infection. The next type of the lesions that happen in neonates are the traumatic lesions. The traumatic lesions that are commonly seen, one in the form of the mucocele. Mucocele is what? It is an alteration of the minor salivary glands as they are full flown in mouth. So it happened in 2.7% of cases in neonates less than 1 year of age. It could be the extravasation or the retention mucocele. The lower lip is most commonly involved in the form of the bluish translucent fluctuant swelling. It happened because of trauma because it leads to the mechanical obstruction during the feeding. Identification or evaluation is basically through either the histopath or FNAP. Surgical excision is the treatment of choice. Quite similar to mucocele is the ranula. Ranula is rare in occurrence. It happens over the floor of mouth. It is caused by extravasation of mucin, and it happened in around 0.74% of cases. It is quite similar to mucocele. Only identification is its bigger size and the placement where it is present. Histopathological assessment, FNAB and MRI are the identification markers. You can see it as a true retention cyst with the presence of epithelial lining. The treatment involved, if it is quite large in size, we go for the marsupialization. Otherwise, surgical excision can be done. Nowadays, even the cryosurgery can be preferred for the ranula cases. Rickeffer disease. It is a disease or a syndrome, so it is a rare benign reactive mucosal disease that is commonly associated with the natal and the neonatal teeth. We commonly see the ulcer over the ventral surface of tongue because of the irritation due to natal and the neonatal tooth. The treatment involved extraction, either the smoothing of incisal edges or use of some protective dental appliance. This is one of our case of 7 months old preterm baby. Here you can appreciate a ulcer that is present over the ventral surface of the tongue. This was because of the two natal teeth that were in origin. So finally, we decided to go for the treatment is the extraction of both the teeth because they were highly mobile and they were interfering with the feeding of the child. The lesions because of autoimmune diseases. Neonatal pemphigus vulgaris. It is a rare in occurrence. It is a rare kind of vesiculobullous disease caused due to the transpalatal passage of maternal immunoglobulin G autoantibodies. It happened in the form of the multiple cutaneous mucosal or mucocutaneous ulceration soon after birth, but it gets resolved in 2 to 3 weeks' time. The identification could be through histopathology and immunofluorescence methods. Then coming on to the tumors, we encounter benign as well as a malignant tumor in case of neonates. So we encounter benign neoplasm, then we have the teratomas, the choristomas, salivary gland neoplasm, and even the malignant neoplasm affecting the neonates. So coming on to the benign tumors, so there are various benign tumors that are commonly seen in the neonates. So coming on to one by one, the hemangioma, that is the most common pediatric vascular benign neoplasm with the female predilection, and 60% of the cases are encountered in head and neck region. It happened in the form of the rapidly growing macule followed by regression into the spotted pigments. The identification or the diagnosis could be made through the histopathology along with the clinical diagnosis. Beside histopathology, you can go for the color Doppler USG, MRI or FNAC, and immunohistochemistry with the biomarker glucose transporter 1 can be the identification. The treatment involved the corticosteroids. The laser could be used for the management, and even the surgery can be done. Next one is the lymphangioma. Lymphangiomas are again the benign neoplasm of lymphatic channels. These happen in 1 to 3 cases out of 10,000 live birth of the neonates. They affect both the genders. Commonly, 75% of the cases happen on head and neck, involving tongue, lips, buccal mucosa, soft palate, or floor of mouth. They could appear in the form of the superficial bluish black or red hemorrhagic elevated nodules, and ectopic deposition of lymph tissues are commonly seen. The identification could be the histopathological. Then you have the color Doppler USG, MRI and CT scan can be done. The treatment involved the steroids, electrocautery, cryotherapy, and surgery. Then we have the wide group of disorders that involve the histiocyte as the common cell origin. The Langerhans is seen 1 in 2 lakh children under 15 years of age with the male predilection. They are variant and congenitally self-healing kind of tumors. They appear in the form of the petechiae or the lytic bony lesions, and they leads to the swelling of gingiva because of the accumulation of Langerhans cells. The diagnosis can be made through the histopathology and immunohistochemistry. Intervention involved the surgery, radiotherapy, and the chemotherapy. Congenital lupus is rare and having the female predilection with around 8 to 10 times as compared to males. Then the maxilla is most commonly involved as compared to mandible, involving the alveolar ridge, especially at the area of canine. It appears in the form of the lobular or ovoid lesions, sessile or pedunculated swellings. They are being covered with the smooth normal or even the reddish mucosal surfaces. They are identified either through the histopathology, CT, MRI, or USG. And the treatment of choice is the surgical excisions. The rare pigmented benign neoplasm involving the melanocytes, they happen in the first 6 months of the age of the neonates with the male predilection. They originate commonly from the neural crest cells. 92% of cases involve the craniofacial regions. So these are basically involving the tongue, palate, buccal mucosa, floor of mouth. They are painless, non-ulcerative, expansile, and rapidly growing pigmented lesions, and they show a locally aggressive behaviors. CT, MRI, or histopathology help in the diagnosis, and the treatment involve the chemotherapy, radiotherapy, and finally the surgical excision of the tumor. Teratomas like the epigenethus. So this kind of a teratoma is rare in origin. It is attached to the base of skull and extend to hard palate and the mandible. Female predilection is seen in this kind of teratoma. Teratomas are basically derived from the pluripotent cells of any germ cells. They happen to grow unilaterally. They even show the rare intracranial expansion, but it happens rarely. Commonly, they are associated with the cleft palate and bifid tongue or bifid nose. USG, CT, MRI could be the diagnostic investigations. They always have the poor prognosis. So mortality rate is quite high in these kind of teratomas. Oral choristomas, these are histopathologically normal tissue in non-native locations. So basically, histopathologically, they are quite normal, but they are located at the abnormal positions. They are rare aberrant developmental disorder with the male predilection. They are asymptomatic and occurring in the large masses, commonly involving the head neck area where the tongue, floor of mouth, and pharynx could be involved. Now, the salivary gland, cartilaginous tissue, lingual sebaceous tissues, gastric respiratory mucosa, osseous, lingual thyroid, or the glial tissues, they could be incorporated in these oral choristomas. They cause the obstruction in feeding and respiration in neonates, and the diagnosis could be made through histopathology and imaging, and the surgical excision is the treatment of choice. Salivary gland neoplasm. The first one is the xyloblastoma. This is a kind of a rare salivary gland neoplasm of epithelial origin that happen in the neonates. It occurs as a swelling involving the parotid or the submandibular gland, but it can lead to the facial nerve palsy if it is involving the parotid gland. Surgical excision is the treatment of choice for the xyloblastomas. Hemangioendothelioma of the parotid gland, that is involving the parotid gland. This has the female predilection the 3 times as compared to the male. These are the multiple rapidly growing parotid masses, oftenly associated with some cutaneous lesions. But the major involvement is the facial nerve. It leads to the damage to the facial nerve. Again, you have the diagnosis based on the histopathological and the imaging techniques. Surgical resection is the treatment of choice for such type of tumors. Now coming on to few malignant neoplasm that has been reported in the neonates till date. These are the malignant melanoma, spindle cell sarcoma, and the rhabdomyosarcoma. Although they are quite rare, but they are reported in head and neck areas. The oral cavity involvement is still rarer, but they are reported like malignant melanoma has been reported on hard palate. Spindle cell sarcoma and rhabdomyosarcomas are reported on the tongue. So because they are malignant in origin, so it is highly important to have the prompt diagnosis and multimodal management of for the disease-free survival. So another condition that is the preterm birth. Preterm birth can lead to the various lesions in the neonates, various lesions in the oral cavity of the neonates. These include the dilacerations of the crown because of the endotracheal intubations, distortions of the dental arches, especially the maxillary arch. Then the enamel opacity and the hypoplasia can be seen. Increase in the height of the palate, that is commonly we observe the V-shaped palate. Delay in the eruption of the primary dentition, and even the growth of the permanent dentition can be impaired in the preterm births. Now, after discussing all these lesions in the oral cavity of the neonate, we have to incorporate the reassurance for the parents. Because these kind of lesions, when encountered in such a small child, the neonate, that is newly born child, So the parents have a lot of anxiety about these kind of lesions. These are incorporated with various kind of the myths. So it is highly important to reassure the proper management of such lesions and what are the prognosis and outcomes for these lesions. So parental reassurance is quite important. No doubt, most of the lesions are self-limiting and they are benign in nature, but the reporting by the parents, it's quite limited. So the adequate knowledge and awareness to the parents is highly important, and this could be given by the various child healthcare workers, especially the pediatricians and the pediatricians. The parental counseling and reassurance help to report these lesions in time, and this will help in adequate management of the lesion and related symptoms. This help in reduction of the chances of giving the inappropriate medications to the child, the nutritional deficiencies, and the misconceptions relating to the lesions. As we all know, the goal to success is always the teamwork. So here, when we are discussing about the neonatal lesions, so the appreciable effort is by the oral pathologist along with the periodontist. So we can share the knowledge and for the proper clinical, radiographic, and the histopathological diagnosis, for the proper prognosis, the treatment, management, and the outcomes for the neonates. So the gist of whole presentation is the adequate knowledge, then the team efforts and the precise diagnosis and the management, because alone we can do so little and together we can do so much. With every newborn baby, a little sun rises, the sun of hope and the future perspectives. Thank you so much for the patient listening. And in any case of questions, you can just contact me on through mail. Thank you so much.